spouse benefits if you're currently married or even divorced. We're going to help you maximize all your spouse benefits in it's called a split strategy. So what we're going to do is, as usual, we'll talk about today's topic, which is exactly that, a split strategy. And then that should take about 10-15 minutes to talk about that. And then I'm going to open it up for all your questions about all things Social Security, Medicare, Medicaid, retirement, disability, and all that kind of good stuff. So make sure you add your question to chat. And if you're just going to stick around here for just the maximizing spousal benefits, make sure you subscribe. If you don't have any questions today, if you're not going to stick around, make sure you subscribe and like, because inevitably you'll receive a weird letter from Social Security Administration, or you or your friends or family need any need help or have any questions, you can reach out to us. You can find us again if you subscribe and like and all that good stuff. So all right, so let's get right into it. What is a split strategy? All right, so if you're currently married, and this also applies for a divorced spouse, but it's a little bit different for that case. But if you're currently married, what happens is a split is basically you start your Social Security retirement benefits at different times, depending on which spouse has the higher earnings. And if the spouse with the higher earnings is usually still working, possibly. So what you go ahead and do is the lower earning spouse goes ahead and files as soon as they possibly can, which is obviously 62 years old. So they start their benefits at 62 years old. And then the higher earning spouse waits until they're full retirement age or 70 years old and gets the delayed retirement credits. And that way, the lower earning spouse gets those checks. Obviously, you have to stay within the annual earnings limit. And this year, it's $22,320. So if the lower earning spouse is staying under that limit, then they can go ahead and collect their benefits. And then when the higher earning spouse collects later at 63, 64, 65, 67, whatever the case may be, then the lower earning spouse files another claim at the same exact time. So what you do is the higher earning spouse years later calls Social Security, says, I want to go ahead and file for my retirement benefits. Perfect. You do it over the phone. The higher earning spouse does the claim, gets the benefits started, and then hands the phone over to the lower earning spouse. And that person goes ahead and files a spouse claim. So that's three claims: lower earning spouse retirement claim, a spouse claim, and the higher earning spouse does a retirement claim themselves. And that way you've maxed the benefits. And the benefit of that, obviously, is that the lower earning spouse can get up to 50% of the higher earning spouse's what's called the PIA, the primary insurance amount. So the primary insurance amount is basically how much you will get at your full retirement age, not 62, not 70, but your full retirement age. That's the number that Social Security uses to determine if one spouse's benefits is less than half of the others. Let me go ahead and throw up a little diagram I did here on exactly that. So let me take out all of the little tickers and all that interesting stuff at the bottom. And so here we go. Okay, so you've got, let's say the husband is making is the PIA, again, benefit the high at the full retirement age. PIA is $2,000, and the wife PIA is $800. So the wife's PIA is less than half. So what happens is, so let's say she files and she gets $800, and there's $200 left over there. So she files a claim on her own record, gets the $800, and then half of 2,000 is 1,000. So there's $200 left there. So the wife can get $800 plus $200 for a total of $1,000. So that is how the 50% works. If you're going to go ahead and file early, those numbers are obviously reduced. And I just did a video on that a few days ago, and I went a little bit more detail on exactly that particular issue. So if you're interested in early retirement and early spouse benefits and all the rest of it, make sure you check out that video. So that way you're maximizing your benefits. The lower earning spouse is getting that check because there's no use in waiting. So you can see there's no use in waiting for the lower earning spouse to, delay receiving their check because it's just going to be increased to what half of the higher earning spouses in the future. So if the lower earning spouse gets 500, 600, 700, $800, whatever the case may be, once the higher earning spouse goes ahead and collects, then the lower earning spouse gets up to that half. Okay. So, all right. So that is for couples that are currently married. So this is a strategy that a lot of married couples use. And you can also kind of use this independently entitled divorced spouse. I want to throw this out there because I know there's hundreds of thousands of people that are not receiving benefits. And you can't really do the split strategy exactly the same, but I'm trying to get the information out there to as many people as possible so you get your benefits. If you are divorced and your ex-spouse is not receiving benefits, a lot of people out there think, well, okay, I can go ahead and file for my own benefits, but I can't file on the ex-spouse's record because they haven't started their benefits, and they're not going to wait until they're not going to collect benefits until they're 65 or 67 or 70, and this is killing me. And I need the money. Doesn't matter have you been divorced from that person for 2 years, and obviously you had to be married for 10 years, so you had to be married for 10 years and then finally divorced from that person for at least 2 years, you can file what's called an independently entitled divorced spouse claim. As long as your ex-spouse is 62 years old, you can file. Doesn't matter if they filed or not. If you don't have their social security number, no problem. Just call Social Security and give them the name, the date of birth as close as you know it, where they're born, city and state, and Social Security employees will be able to find it. I've never not been able to find when I worked at Social Security Administration. So very easy to find someone's Social Security number. So you call up, and if you are receiving your early retirement now and you're sitting around and waiting for your ex-spouse to start their benefits, don't call immediately the 800 number, 800-772-1213. Call Social Security Administration and tell them you want to file an independently entitled divorce spouse claim. And they will look at the record and see if there's actually any money left over. Because again, the PIA, yours has to be less than half of the previous one. And it doesn't need to be the last one. It can be, if you were married 3 times, Social Security employee will look at all 3 records and see which one has the most money. So you can file on a first spouse, second spouse, third spouse, whatever, doesn't matter. Which one ever has the most money, that's the one you go for, obviously. All right. So call immediately. And if you know anybody that's sitting around waiting for that, because please, I know there's hundreds of thousands of people out there that need that money that aren't getting it. So please help out your community and help out your friends and family and let them know about that. All right. So there's also another benefit from having the higher earning spouse delay retirement. Obviously, they get higher benefits and everything, but also in terms of delayed retirement credits and survivor benefits. If the higher earning spouse passes first, then their surviving spouse essentially gets what that person was receiving. If the surviving spouse is their full retirement age, they'll get 100% of what the person was receiving, including, as a lot of people miss, including the delayed retirement credits. And the delayed retirement credits are the ones that, after your full retirement age, every month you wait to collect your Social Security benefits, it's increased. It's basically increased 8% for every 12 months. So from 67 to 70, that's 24% increase of your Social Security benefits. That does not go to a current spouse. If you're still alive and kicking, the current spouse, if you're alive, does not get delayed retirement credits. Only when you pass. When you pass, they get delayed retirement credits. So a lot of people miss that. So, all right. So that is the split strategy and DRCs and independently entitled divorce spouse and all the rest of it. So let's go ahead and open it up for any questions on all things Social Security, retirement, disability, survivor benefits, spouse benefits, Medicare, Medicaid, all the rest of it. If you were just around here for the split strategy, again, make sure you subscribe, and that way you can find us in the future. Okay, let me look at the questions here, see what we've got. Greg, thanks. I was able to reduce my monthly overpayment today from 251 to 90. That will help a lot. All right, Greg. All right, he watched the videos I did on overpayments. They just changed the law thanks to old Anderson Cooper and 60 Minutes, an expose they did a while ago. See, if we get enough publicity on stuff, it'll get changed. And, Greg needs to send a nice little letter to Anderson Cooper, said, thanks, buddy. The Vanderbilt family. Huh, interesting. Gloria Vanderbilt's his mother. But anyway, yeah, they just changed it to where it made it a lot easier to do a repayment of 60 months. Traditionally, before a couple of months ago, if you had an overpayment, Social Security employee could do 12-month repayment easy. 24 months, a little bit more difficult. They would have to get their supervisor to sign off on it. Anything after that, they'd have to go through the whole, okay, bring us all your documents and how much you pay for rent. And, they'd have to go through the whole thing, and it took a while. Now, you pretty much just call them up on the phone and say, hey, I want to take advantage of that 60-month thing. And the great thing is it's interest free. So you don't have to pay interest just to expand it out. So yes, please, everybody should take advantage of that. All right. I was just widowed by my second husband. Can I qualify for divorce spouse since I am no longer married? Yes, if you're no longer married, and there's all kinds of different exceptions. But yeah, in your case, absolutely. So since it depends on how old you are, obviously, because you're now a widow, you can collect survivor and spouse benefits at 60 years old. But if you were married to someone else for 10 years and they're still alive and kicking, then you can collect up to 50% of whatever benefits they were receiving. Oh, and she writes it in here. She puts, I am 61. Okay. All right. So the only thing you're eligible for right now is survivor benefits. Once you hit 62, then you're eligible for divorced spouse benefit. And then she adds another one here. Let's see here. My ex's benefit is much better than my late spouse's benefit. Okay. Yeah. So you always go for the best one. Absolutely. Whichever one's the highest. And if you don't know for sure, then, call Social Security and tell them you want to file a claim on divorced spouse or surviving spouse, whatever the case may be, just so you'll get into the office and talk to a claim specialist. And then they'll give you the numbers, and then you just say, oh yeah, by the way, I also have this other situation. Let's check how much money is there. And you can always switch. So if you're receiving survivor benefits on a second spouse, because that's higher because the first spouse is still alive and kicking, you're receiving survivor benefits on the second spouse and you're going along, and then all of a sudden your first spouse passes away and now you're eligible for survivor benefits on this first spouse, then switch over. And I know there's tens of thousands, hundreds of thousands of people out there that think, okay, I can't do it because I'm already receiving survivor benefits on this one. No, you can switch. You can definitely switch. So get the higher benefit amount. Again, you had to be married for the person for 10 years and all that kind of stuff. But if there's more money in there, absolutely get it. All right. Just Jeff. Hey, a couple of Q&A episodes back, you said the Ticket to Work program is complicated. Complicated is not what I need. Is there any way to avoid the program, report earnings, and still get the incentives? Yeah, I mean, well, in incentives, obviously, you've got the trial work period. You still qualify for everything. The trial work period, the 9 months, not necessarily consecutive, to work as much as you want to try to see if you can work. You're still eligible for that. You're still eligible for the extended period of eligibility, the 36 months, and all of that. But yeah, as long as you got Ticket to Work, and then you got the AWIC, the Area Work Incentives Coordinator. So call your local Social Security office, and that's actually a Social Security employee that works in your area, and should be able to help you out. Yeah, you just you work and you report your earnings and everything, and you keep you make sure you keep a little note of who you told and what you talked about, in case something gets misconstrued in the future, let's say. So, all right, let's see here. I'm 75. My husband died. He didn't have enough credits for Social Security. He was collecting on the basis of his marriage to me. Can she get a widow's pension for any other benefits? Yeah, unfortunately, no, because he couldn't get it off him because he didn't have enough credits. Unless you were married before to anybody else, if there's another ex out there, then I would definitely check out on that other person. Sweetbug, hey, how have you been? I haven't seen you in a few days or so. If a person cut off widow's pension to start their own Social Security, how long will it take for Social Security to start? Is there a waiting period at 62? Yeah, as long as you, so you're going to start on your own, as long as you're 62. Yeah, call up, a month or two before you turn 62 and say, hey, I want to switch over to mine because it's more money. And it doesn't take that long at all. Again, the claim itself takes, 20, 30 minutes. You don't need any proofs because you're already in the system and everything. You already prove your birth and all that kind of good stuff, your date of birth and everything. So it's not it. Yeah, it's super, super easy. I've done a few million of those. I know a few million, a few 100,000. Kevin, I filed for SSDI in July 2022. I got approved in September 2023. Good. Well, took him forever, but sorry about that. I got my first check in February. Do you know why Social Security doesn't pay you from the month that you filed? Yeah, it really depends on. So there's all kinds of variables. If you worked at around that time, then you became disabled, but you didn't stop work until this month. Then there's a 5-month waiting period. Everybody has to wait 5 months. They don't get their check immediately. And then they can only go back, a year sometimes to bear when you filed. So yeah, there's just tons of variables. But if you disagree with your onset date, it's just called the onset date, then you can definitely ask for a reconsideration. And so they will send it back up and check it out again. But I have to be, fully above board here. You're reopening your case, and you might send it up there and they might agree with you and say, okay, yeah, we should start this person, a month or 2 months or 5 months or a year earlier. Or someone else could look at it and say, why was this person ever approved? So you take that chance, unfortunately. So sleeping dogs type thing. I don't know. It's completely 100% your decision. But so if September 2023, so it depends how far they go back. Remember, you're going to get Medicare after being on Social Security disability for 24 months. So it looks like within several months now, you're going to get Medicare. So make sure you plan for that and give us a call if you need help with all kinds of Medicare plans. Okay, all right. I think it was a repeat there. Steve, what's up, Steve? In your example, if the spouse claims spouse benefits, does the limit the wife from claiming 100% of spouse benefits if higher spouse passes? No, because their surviving spouse benefit amount depends on when the higher earning spouse passes away. So yeah, they wouldn't receive if the lower earning spouse files at 62, and then the higher earning spouse passes away the next month, then yeah, and the surviving spouse collects immediately, then there's going to be a full reduction. But if the higher earning spouse passes away and the lower earning spouse starts collecting benefits at their full retirement age, then they get 100%. All right, and then there's this weird thing called the rib limb. Also on the internet, they call it the widow's cap. If the higher earning spouse collected their benefits way early, 62 or 63, but that's not in this split strategy type thing. There's as I say, with all my videos, there's exception to exception to exception. All things Social Security, it's just way too complicated. That's why y'all got me to walk you through all this good fun stuff. Anyway, Cindy, what's up, Cindy? I was married 7 years, filing jointly. We worked together, and Social Security showed zero income for me. How to resolve this? Yeah. If you were married 7 years, it doesn't matter anyway, so I wouldn't worry about it. You had to be married 10 years to collect benefits from that person's record unless you were married when they passed away. But yeah, I did a video on this. I think I need to do another video on this. This is couples that have a business together. Accountants always mess this up. Accountants, CPAs, they know IRS, hopefully, but they don't know Social Security. And what often happens is if a couple has a business together, they file taxes together, and the tax thing, they both owe the money. That's no big deal. That's simple. But what happens is often the accountants put all of the earnings, the net income, on one Social Security number. And which is fine. That increases that Social Security number, the benefits, retirement benefits and disability benefits and everything quite a bit. But the problem is if they eventually get divorced, then as Cindy says here, she's left with zero. So that is a conversation that couple business owners should have. Okay, if we're going to stay together, then yeah, you take all the earnings so you get the highest benefit amount and I'll just collect off of yours, or stay together for the 10 years so you can get the spouse benefits. But yeah, that's unfortunately. Strong Rock, hi, can you tell me if they calculate your 35 years of working on all your average yearly income, or is it the best 35 of your income that you must meet a certain yearly income? Yeah, you have to get credits for those particular years. So for those, quarters of coverage, so you need 10 years and it's your high 30, I'm sorry, it's your high 35 years. Let me back up a little bit. So yeah, you were asking about, you had two questions there and I kind of joined them together. Okay, so it's your high 35 years. So you have to get credit for what each of those quarters and each of those years. But it's your high 35 years of earnings, and not consecutive. So it could be, 5 years when you're young, and then a couple of years later, another 5 years here, and another year here, and another year there. And then when you work, if you continue to work, even after you receive Social Security benefits and pay into Social Security, and that's one of your high years, then Social Security automatically adds that in there, kicks off the low, and adds the high one in there, and then recalculates, and that's 100% automatic. You don't have to do anything. Jimmy, can I get a number to call for Medicare and Advantage plans I qualify from? Yeah, basically, yeah, absolutely. So let's see here. Call, I think I got my number down there. Let me put it up here. So yeah, if you know someone that you know and trust that can help you with, Medicare insurance agents can help you with all things Medicare Advantage, Medicare Supplement, and all that kind of stuff. Okay. But if you don't, then reach out to us, and I've got a nationwide network of brokers that can help you out and take care of you. So call that number, email me, tell me your name, give me your phone number, the state you're in, because they're all state specific, and what you're looking for. And I can find someone in your neck of the woods to help you out. All right, let's see here. Shirley, if my husband was in the military, can they ask his military time with his Social Security so that I can get my widow's pay from him? Yeah, if he was in the military, his military time was already included in there because of the pay. But you're probably, maybe you're talking about that little bonus thing that it's only a few dollars, extra a month. But hey, a few bucks is a few bucks. But yeah, if your husband was already receiving Social Security benefits, then they already probably asked him about when he served in the military, and they gave him that benefit. But if for some reason they didn't, and you think maybe they didn't include that, you can call up Social Security if you're receiving benefits from that record and say, hey, by the way, did you add his military time to his Social Security record? And they can look real quick. And if not, then you just send them a copy of the DD-214. And you can get a copy of the DD-14 at the National Archives. It's NARA, NARA.gov. and you should be able to get one from them. All right. S. Holman said, thanks, Ed. You're welcome. Can you get pay from your second husband if you only was married for 8 years? No, unfortunately. Unless you were married to them when they passed. Jimmy, I'm 61. My wife is 47. We both have worked all our lives. I have a pension from the government and currently working full time. Should I collect at 62? We have young children, 7 and 9. All right. Yeah. So, all situations are different, but what a lot of people do in this case is, so if you're getting close, so 62, so yeah, this is definitely time to ask this question. If yours is the higher benefit amount, usually recommend waiting. However, because you added on there, you've got a couple of kids. Here's one thing you need to consider. Okay, you collect benefits early at 62. And because you have 2 children under the age of 18, those 2 children can also collect benefits. So even though if you're going to be, reduced 62, and once you file early, you're essentially, and you continue to receive benefits, you're essentially reduced for the rest of your life. So you have to take that into consideration, how much you're going to lose, and depends on how long you're going to live and all this, your health and your, genes and all that kind of good stuff. But you've also got 2 children. And they can collect benefits up until they're 18 years old. So you also need to figure that. So you collect your benefits, the 2 children collect your benefits. And if your wife is not working and not earning over the annual earnings limit, she can file what's called an auxiliary child in care, because she, is essentially staying home and watching after her children. She can get benefits too, but there's a family max. So if the family max is $3,000, and but each person can be entitled to $1,000, so that's $3,000, no problem. But if the family max is $5,000, and or let's say $2,000, then it doesn't divide out. So sometimes it doesn't pay to do the child in care benefit because it reduces the other 2. But when you call Social Security, that's their job. Is you call them up and say, okay, I want to file for benefits on my own record. I want to see how much my children will receive. They'll receive 50% of your PIA. And is there any money left over for an auxiliary child in care benefit as well? And they'll tell you, oh yeah, no, it's just going to reduce the other 2. And you go, oh, okay, all right, so that's not an issue. But if it's, oh yeah, there's still money on the family max, then you've got more money coming in, and that just might compensate you for taking that early retirement. So yeah, so there's something to consider. And you said you work for the government. Hopefully well, it sounds like you did pay into Social Security, so you're not one of those, city state ones that did not pay into FICA, it sounds like. So there is that. All right, let's see. Red Horse, I'm turning 65 in July. I just applied for benefits parts A and B. As a retired military, I'm also eligible for Tricare for life. Knowing this, would you recommend getting Plan G or N as well? Medicare supplement, probably not. If you've got Tricare for life, you got Part A, Part B, I probably wouldn't pay for a supplement, because you've already got Tricare for life. And yeah, so some people do get a Medicare plan, but they get a Medicare Advantage plan because it doesn't, there's a bunch out there that you can probably choose from in your area that doesn't cost you a monthly premium, but gives you extra benefits. So you use, the veterans, the Tricare for life for a majority of things. But if you ever want a second opinion, you've got those options, and you might get some extra dental or hearing or vision or something like that. So I would definitely check out that. But probably, yeah, I don't think not many people get a supplement because it just costs the extra money and everything. So probably Medicare Advantage. And actually, I'm going to do my topic tomorrow, and obviously a live Q&A afterwards, is veterans and Medicare and disability. So the disability part will be like super, super short because it's so easy. Chris, to be clear, if lower earning spouse or ex-spouse files at 62, their benefits, including survivor later on, are permanently reduced. Correct. Okay. No. Okay. So if the lower earning spouse collects, so this is on their own record. So they wouldn't be collecting on the spouse because that person is still around. So if the lower earning spouse collects retirement at 62 and then survivor benefits at 62 because the person passes away a month later or something, then yeah, it's reduced forever. But those are different on established dates. So early retirement for 62, and then survivor benefits. Hopefully, the survivor benefits. You're able to wait until your full retirement age, and you can collect essentially 100% of what that person was receiving. So there are two different start dates. So one is reduced, and the other isn't. Josie, my husband and I are both on Social Security. My question is it better for me to collect on his and delay mine? You can't do that. He makes more on Social Security than me. He's 74. I'll be 69 in August. Yeah, you have to file for benefits on your own record. There was an old system called file and suspend that stopped back in 2016. But if you are 69 and they are 74, you're already both on Social Security. Is it better for me to collect on his and delay mine? No, you can't delay yours because you already started it anyway. But you're filing on yours, and hopefully you check to see if there's any more money on his record because you're your full retirement age and it's not going to go up anymore, and it's not going to affect survivor benefits, obviously, or anything. So yeah, I would call Social Security immediately, if not sooner, and say, hey, is there any survivor benefits here? So it has to be, again, his full benefit amount, not what you're receiving, not what he's receiving, but your PIA. Yours has to be less than half of his. And how to find out what your PIA is, call Social Security and they'll tell you. You just basically call Social Security and say, hey, I want to file a claim on my husband's record as a spouse. And they'll look at the calculations, they'll look at the records and take them 2 seconds. They'll say, oh, no, yeah, sorry, there's no money there. So we're not going to set up an appointment because there's no money. But if there is money, then they'll set you up an appointment at your local office. Jeff, hey, thank you so much. You're truly a blessing. Thank you. I'm going to pull the trigger here real soon and get back to at least part-time work. I'm tired of sitting around and doing nothing. Yeah, I agree. That's, I retired and it took me about 10 days. Jeff, had 2 heart attack survivor with many different medical issues, but I feel I could do a little something and still be safe, and I could earn at least 2 credits I need for full retirement. The last 2 credits I need for full retirement. So that's the last. So you only have 38 credits. So you work less than 10 years. Is that what we're talking about? Because the high 35 years. But not sure. But yeah, definitely. Yeah, get out there and get moving. How have disabled adult child on Medicaid and Medicare getting dual advantage plan with Medicare savings program? Was I supposed to also get them Part D? Yeah, it's in there. It's already in there. Yeah, if you have a dual advantage plan, or even if you have Medicaid, they sign you up automatically. So yep, you already have Part D. But very good question. You are doing good there. You've got your dual advantage and your Medicare and Medicaid. It's a beautiful thing. Next year, the Center for Medicare and Medicaid Services, CMS, Medicare, same thing. They are finally clamping down on Medicare Advantage plans and saying, okay, buddies, you're giving out all these, different benefits, dental, vision, hearing, gym membership, all this kind of stuff. And you're getting people to sign up with your company, your plan based on all those cool little bells and whistles. But people aren't using them. So what's going on? Are you not telling them about those, or you're not advertising them, or you're making it difficult to people forget to get those? What's going on? How come people aren't really using those as much as they probably should? So starting next year, the middle of next year, CMS are mandating those companies to send like a reminder letter. And it sounds like in the middle of the year that says, hey, by the way, we just want to let you know that, you have, let's say $3,000 of dental, but you haven't used any of it. And, all this stuff disappears on December 31st. All Medicare Advantage plans are only good for 1 year. And so whatever money you got or whatever it is, it all disappears December 31st. And then the next year, if it's there, if it's not, you don't know. Nobody knows until October. And if you want for us to put you on the list for when the new plans come out in October, so we can reach out to you when the new plans come out and review yours, just email me, call and say, hey, put me on the list. Here's my phone number. Here's my state. And we'll put you on the list. And when the new plans come out, we'll call you. We'll schedule an appointment with one of our trusted partners throughout the country, and we'll see if there's anything better. And in September, you also receive, so if you have a Medicare Advantage plan, you're going to get 2 letters. It sounds at least 2 letters next year, every year. You'll get the, hey, you haven't used these extra goodies. And then in September, you receive the ANOC, which is the annual notice of change. And that tells you all of the changes for your plan for the following year. And what a lot of people do, they say, oh, still zero premium. It still has my same doctor. Okay, I'm good. So I guess everything is good. And then when something happens, they fall or get injured or get sick or something, they go to the hospital or something, and all of a sudden, you get charged $100 here, $500 here, $1,000 here. And how come? Wait a second, my plan last year didn't have that. Well, yeah, remember that letter in September in the fine print? Yeah. So that's why it's important to go through those every year, and we can help you do that. So just give me a call, email me, and we'll put you on the list. Peanut. Hello, Dr. Ed. If my ex-spouse of 23 years collected on Social Security early at 62, how does that affect me on collecting? Doesn't. I will be 65 in June. He has been collecting 3.5 years. Yep, doesn't affect you at all. Nothing, period. Because your benefit amount is based on his PIA, the primary insurance amount. So their primary insurance amount. So yeah, whatever time they collected, it doesn't really matter. One thing it does affect is survivor benefits. If you're going to collect survivor benefits eventually on that person's record, then you essentially will receive 100% of what that person was receiving. So if they're filed early, then yours will be reduced as well. So Nancy, can I collect on my ex's spouse record at 67 for 3 years and then switch to my record at 70? We were married 25 years and I have never remarried. Thank you. If that person is deceased, yes. But if that person is not deceased, you have to collect benefits on your own record first and then file for benefits on that person. If that person is deceased, then yes, 100%. That is a very good strategy. If you haven't touched yours, then you go ahead and file for survivor benefits. You start getting survivor benefits, you let yours increase, and then you jump over onto your own. So but you always have to file if your spouse, current or previous spouse, is still alive and kicking, you have to file for benefits on your own record first. Carol, my ex-husband has reached his full retirement age but hasn't filed yet, and I will reach my full retirement age in November. Does he need to file for me to get FRA percentage at my FRA in November? No, because you will be your full retirement age and he doesn't have to file. Remember, the independently entitled divorced spouse. So you go ahead and file for benefits on your record, and then you file an independently entitled divorced spouse benefit on his record. And it doesn't matter, when he files or if he files or whatever the case may be. Your benefit amount will be based on his primary insurance amount, whether he collects or not. So, yeah. And if you're approaching FRA, approaching that, you might, it might be a benefit for you to start a little bit early. So call up Social Security, set up an appointment, and say, hey, what if I go ahead and start now? And they'll say, oh, da, 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 da. And if it's only a few dollars or 10 or 20 or 30, $40 reduction, but you can get your benefits, you can get, 5, 6 months ahead of the game. You're like, oh, okay, I can get, $10,000 now. Sure, it's going to reduce me, 30, 40, $50 a month forever. But yeah, I can take that $10,000 now and do, something with it. So yeah. And then if it turns out, oh yeah, I'll just call back and, I don't want to, I'll wait till my full retirement age in November. Then you just tell them, okay, all right, thanks, but no thanks. And they will not be mad that they didn't get the sale. They'll be very, very happy because now they have 5 more minutes of their day to, take a de-stress or go to their next appointment. I'm ME58. I'm 55, claiming disability through my Social Security. I'm receiving widow survivor from an ex-military husband. He passed at 53 while in disability. Social Security said I can only receive $300, $340 from my survivor. So you are filing for disabled widows benefits. So yeah, the disabled widow benefits is 71.5% of that person's primary insurance amount. So make sure you watch if you're claim. Okay, have you already filed for those benefits? If you haven't already filed, make sure you check out the videos. I did like 3 or 4 videos within the last few weeks on filing for disability. Make sure you watch that, little tips, tricks, and secrets on getting benefits. Carol, medical B payment was deducted from my Social Security of the first month of Medicare. I qualified for payment to be paid. Oh, okay. I think you sent a comment in the. I saw a comment today in one of the videos. So I think that might have been you. So same question. Yeah. So I think you qualify for the payment to be made. So Carol is very smart. So I wish more people would do this that need the help. Everybody has to pay Medicare unless you have someone to pay it for you. The Medicare Part B premium, the $174. So Carol was smart and she went and got herself qualified for the Medicare Savings Program. And please pass this on. I think I need to do another special video. I'm going to write that down. I've got tons of videos. I'll do that one. The Medicare Savings Program. I will do that the day after tomorrow. I'll do another video on that. But anyway, for y'all, or as we say in Texas, for all y'all. So the Medicare Savings Program is a state federal program, and it basically says if you go to Medicaid and you're approved for Medicaid, and there's several different levels. There's QMB and QI and SlimB and all kinds of different. But if you qualify in the correct level for Medicaid, then Medicaid will actually pay for your Part B premium. So you get paid for your Part B premium. So you have Medicare, you have Medicaid. You can get eligible for those Medicare Advantage dual eligible plans, which can get you some more benefits and cost savings. You also get the extra help with the prescription drugs from Social Security. So you've got like 4 or 5 different programs, agencies helping you out with all your health care. So it's a beautiful thing. But the systems don't talk to each other. So you got 3 bureaucratic systems. You've got Medicare, you got Social Security, and you got the state Medicaid office. And all those systems are trying to talk to each other, and they don't talk to each other. It's like it's like the Marines in Grenada that had different radios. I don't know if you remember that history, but anyway. So yes, so Carol, that was supposed to be paid that month. So super long story short, just wait. If Medicaid was supposed to pay for that month, then it just takes a month or 2 for the systems to talk to each other. And then once they do, they'll put that $174 back into your checking account or you're back into your account. So, but if it's been, can I get a reimbursement from that March 2023? It should, March, if it doesn't show up this month, because it's been 2 months, and it usually takes a month or 2 for all the systems to talk. But if you don't get it by the end of the month, then call, yeah, and this is where you get kind of the runaround because everybody blames each other else. But call Medicaid and say, hey, what's going on? Did y'all, put in the right month that my start is going to be on? So, yeah, definitely reach out to them. Carol, I use the full vision benefit, $400 frames. Dental is just a semi-annual cleanings. Thankfully, I want my healthy teeth. Good, good, good. Yes, use those benefits because, again, as I always say, these companies, these billion-dollar companies that, you sign up for Medicare Advantage plans, they don't get to be billion-dollar companies, by being stupid. And that is your money. So, hey, they gave me, $400 frames. That's that was money you paid into the system. So all those decades you or a spouse or whoever paid into Social Security, the FICA and the Medicare, the 1.45% Medicare, that's where that money comes from. So that is essentially your money you paid into the system. It's when the IRS collects it from you and they send it to Washington and it sits there. And then when you sign up for that Medicare Advantage plan, that company takes their little cup to Washington, D.C. and say, hey, give us Carol's money. And the government gives them X amount of money every month or every year to take care of your healthcare needs. So that is your money. I just did a video on that 2 or 3 or 4 days ago. And the title is How to Get Your Money Back from Medicare. And that's exactly how to get your money back from Medicare. So she just got $400 of her money back. And that is a beautiful thing. Someone complained that I say it's a beautiful thing too much. But I'm still going to say it. So tough. Can a surviving spouse collect spousal benefits even if the survivor does not have enough credits? No. Yeah. Oh, wait, the survivor. Oh, yeah. No, if the survivor is not, doesn't have enough credits for themselves, it doesn't matter. If the deceased does not have enough credits, to not paying the Social Security enough, then nobody can receive benefits on that record because there are no benefits on that record. But if the survivor, never worked, doesn't matter. That's kind of what the whole survivor and spouse thing was intended for, is, for people, historically that, females that stayed home. And so they would get benefits, even though they stayed home and did the I've seen it a few times where if you went out into the market and tried to pay for services that mothers do, I think it would cost like $100,000 a year or so. Babysitting and, cooking and cleaning and, taking playing Uber taxi every day and all those other, it's $100,000 or so. So yeah, so there you go. Responding, I'm receiving that $340 now. If he is receiving $1,240 when he passed away, so $340. So it's $340 probably minus your own. So what they do is it's called a dual entitlement. So you don't receive that 1,200 or whatever, 1,100 above and beyond yours. You receive that total amount minus your own, and the difference comes from that record. So let's see, Josie, is there a limit on how many years you can receive Social Security? Nope. I will be 69. How many more years I could receive my Social Security benefits? Josie, everybody here today is hoping you will receive your Social Security benefits until you're 150 years old. So I'm going to be here, and everybody else on here now is going to be here for the next 50 years. So we'll meet back then, and you can tell us how many years you received your Social Security benefits. But yeah, no, you can receive it forever and ever and ever and ever. So now that's your job, is to get forever and ever and ever. Ed, why can't supplement plan add some extra perks? Yeah. Yeah, they just don't. They, with the Medicare supplement G or N, it just covers the gaps, most of the gaps of original, Part A and Part B of Medicare. And there's no Part D, so you have to sign up for Part D separately, and that's what a lot of people are not doing. They're not signing up for the prescription drug plan when they're supposed to, and they're getting penalized for the rest of their life because they say, oh, I don't need it because I don't take drugs. Well, it doesn't matter. when you eventually start taking drugs and you go sign up for it, you're going to be penalized for the rest of your life. And you'll be delayed because you can only sign up for it essentially, certain times of the year. Yeah. So there is, um, there are plans out there. One of the biggest insurance companies out there is starting to act, because they have, they have most of the companies that do Medicare supplements also have Medicare Advantage plans. So they have networks and all kinds of different stuff, right? So I've seen one or two of the Medicare supplement plans. They're providing discounts, dental and vision discounts, and gym membership and stuff like that. But they're not, traditional insurance. There's just kind of discounts. All right. Sorry, I've been ignoring TikTok here. And TikTok, I need 10,000 subscribers to treat you all right. So please subscribe. Okay, let's see here. Wife 65, drawing since 62, spouse 59 on SSDI, 2 years now. Can I get anything off his now? Yeah, if you've got a high earnings, or if you got the older spouse and the other spouse is receiving benefits, yes. Well, possibly. I mean, if the higher earning spouse's benefit amount is twice yours, then again, the PIA, then yeah, call Social Security and say, hey, is there any money left on his or her record? And if there is, they will schedule you an appointment. That's basically the only time they schedule an appointment, is when there's a claim to be filed. And you wouldn't file a claim if there's no money. What is a windfall elimination? Windfall elimination it's a weapon windfall elimination provision. It's a provision they started in the 1980s. For It's only about 3 or 4% of American workers. Those are people that worked in state, city, county, government jobs that did not pay into Social Security. I've got a few videos on that. That's always a very, very controversial subject. And yeah, because people just don't understand, windfall elimination. They don't see the windfall part of that. Hi, at age 62, can I collect retirement benefits and work too? Absolutely. As long as you stay under the annual limit, which is this year is $22,320. If you go over that amount, Social Security will hold back $1 for every $2 you go over. And then once you hit your full retirement age, then you can make $1 million a month and nothing is held back. Let's see here. Collect something. X on 100% SSDI. Can ex-wife of 10 years collect off of his at her age of 62? She married, divorced twice. Yeah, if you're not married right now, you're 62, definitely call. When you file for benefits, because you have to file for benefits on your own record first. And then when you go to file for benefits on your own record, say Social Security they will ask you, were you married to anybody for 10 years or longer? And then you tell them, and they will check to see if there's any more money. And if there's any more money, they will let you know, and they'll say, well, do you want to go ahead and get your benefits from that person? And they'll do it right then. Super, super easy. New here. Should I go ahead and take my Social Security at 64, and why? Yeah, it's a complete decision. Personal decision. You shouldn't consider it if you're working and making over the annual earnings limit, because then your benefits will be withheld. But yeah, I mean, if you're 64, call Social Security or go online to mysocialsecurity.gov, and set up an account, and you can find out how much your benefit would be at 64. And then it'll tell you how much your benefit, again, these are estimates. And it'll tell you how much your benefit estimate is at 67. And then you can just kind of, make the decision. So, okay, well, if I get it now, it's going to be reduced X amount of money, but then I'll get checks for the next, 2 or 3 years ahead of the game. And do I want the money now, or, do I want a little bit more later, but and miss all those checks in between? So yeah, completely, as I always tell the people, they, say, well, should I, the number one thing is, the number one number that you need is, as I always say, is when you're going to leave us here on this earth. If you know that date, if 65 is when you leave us, then yeah, get your benefits now, because yeah. But if 110 is when you leave us, then it might be a good idea wait until you're 70 years old and get that higher amount. So yeah, but unfortunately, nobody knows when that is going to happen. If you do, then yeah, wow. Why does Social Security want to reduce my benefits? Because I also get a postal retirement. Yeah, so that is the windfall elimination provision. They're not reducing your benefits, they're correcting your benefits. You're just not getting the extra welfare benefit. Let's see. All right. If a spouse gets military disability, can a spouse be denied regular disability due to what he gets? Yeah, I'm going to throw that into my Medicare or my veterans and disability tomorrow. So, but veterans disability does not affect Social Security disability. Let's see. Hello, Dr. Ed. Are items, okay. All right. Let's see. Oh, are items sold online, like through eBay, count as extra income if I am on 61 and survivors? It really depends. If you're just, selling stuff, but if, selling stuff out of your house or something like that, or, but if it really depends how you report it to the IRS. That's between you and the IRS. If it's a full blown business and you're selling all kinds of, because there's people that make millions of dollars selling at eBay. So if you're one of those, buy me a beer or coffee. But yeah, if you're just, again, it depends how how you tell the IRS. If you're self-employed and this is your business, yeah. All right. Will me applying for husband's benefits, will it reduce his income? No, no. If no, it won't affect if you file for the spouse benefits on a husband or an ex-husband. Doesn't affect their benefits at all. And that's what I did a video a couple 3 weeks ago now about that. Is there's a lot of people out there that want need the money, and they're receiving Social Security benefits on their own record, but they don't want to file on an ex records because they hate that person, or that person has a new family and they don't want to get involved, take money from the new family. That doesn't affect anything. The ex-spouse will not know you're collecting benefits. It doesn't affect their new family, new spouse or kids or anything like that. So get that money. It is your benefit if you were married to that person for 10 years or longer. All right, let's see here. Got some bunch of questions on. Okay, let's see. Did I? Oh, I already did. Okay, let me see, Josie. Okay, I got that one. Okay, here we go. Here's where I left off. How do you find out how much in total you have paid into everything? Yeah, go into socialsecurity.gov, and yeah, it should give you that number and how much you actually paid throughout, how much you earned throughout your life, and then how much you paid into FICA and all that kind of good stuff. Yep. Is it forever? Is it forever as long as Social Security says doesn't go broke? Is the projected 2030 time frame accurate? Yeah, but that's they still pay 70%, but it's not necessarily they only pay you 70%. It's just they have to get the money. But and that's again, that's our job, is to make sure. You know, I did a video on this about a month ago, but yeah, it's our job to make sure our politicians do the right thing, and I think they're kind of slow playing it in that way. They say, well, if we would have done something 2 years ago, we could have had a better solution. But since we have to do something immediately because we're lazy and we were too busy attacking the other party. Yeah, so I think it's our job is to reach out to our politicians and say, you need to do something fast. So. Do you have to wait 2 years before getting remarried per Social Security rules? Nope, nope. Get married immediately. In terms of your, yeah, no. The only 2-year thing in there I'm thinking of is the independently entitled divorced spouse. You had to be divorced from that person for 2 years to do the independently entitled divorced spouse. But yeah. Oh, there we got someone looking out for me again. TIZ. Let's get those likes up. There's 115 watching. Get the likes up. Thank you, everybody. Please press like. I appreciate it, because that means all this goes out to more people. And all you got to do is read in the comments every single day. I didn't know that. I'm a new watch. I just started watching your videos today because Peanut and Terry and TIZ press liked, and they're for TikTok and YouTube and all those algorithms. They send it out to more people, and more people get the information that they need. Let's see, Nina, I'm going to be 50 and trying to get disability. I'm just trying to see what I may be able to get. My last job barely took out FICA. Yes, good. Yes, that is perfect. Kick around all your options and make sure if you decide to go ahead and file for disability, yeah, make sure you watch my 3 or 4 videos on disability. I give you all the insider tips, tricks, and secrets. Terry, they never asked me if I was married to anyone 10 years or more. Huh? When you filed for retirement on your own record, yeah, they should have definitely asked you that. I've taken hundreds of thousands of retirement claims. I always ask that. Yeah. So before, oh gosh, 10, 15 years ago, Social Security used to make us um, record all marriages. And we'd have to, even if it was a year or something like that. But then they say, well, that doesn't really matter. If you were married to someone when they passed, then we recorded it. But if it wasn't that, then they changed it and said, okay, then we asked, were you married to anybody for 10 years or longer? And then if there were any marriages 10 years or longer, then we had to record that. And that's the reason we do is because that can be used as proof later, and then kind of follow-ups to see if there's any more benefits and all the rest of it. So Peanuts, will Medicare suggest Medicaid if income is low? In terms of notifications like letters and stuff like that, they should. I think they do. But yeah, Medicare definitely, yes. I mean, as Medicare as an organization, yes, 100%, because Medicaid is a state federal program. So yes, 100%. Medicare does recommend you sign up for Medicare. Whether they actually send you a letter to remind you, that's a budget issue. But they do recommend you sign up for Medicare if you're eligible. Don Ricky, one brother-in-law told me he lost his SSDI because his wife inherited 100K, and another told me he is scared to put inheritance in savings account with 5% interest because afraid to lose his Medicaid. Okay. All right. So there's 2 different things there. So a brother lost his SSDI because he inherited $100,000. That is 100% incorrect. SSDI is Social Security Disability Insurance, and you can inherit $1 billion, and that won't affect. If you go out there and earn $1 billion, then yes, they're going to kick you off SSDI. But if it's unearned income, because Social Security defines disability as inability to work. So if you're working and make 100,000, yes, they will kick you off. But if it's just an inherited, no, it won't. Your question about Medicaid, or is that Medicare? So yeah. So if it's Medicaid, then maybe he is receiving SSI, which is the welfare-based program. And if he's receiving SSI, yes, 100,000 would definitely kick him off SSI. And he would also lose his Medicaid as well. But SSDI and Medicare, nope, $1 billion you can get inherited. And it won't affect anything. Sally Joe, dad is 82. He gets Social Security. Mom gets Social Security before she passed. Can dad file for survivor benefits? I think you asked that question in chat today. I answered all of my comments today. Yesterday I got back. I responded to all my comments on YouTube. It took me hours, but I finally got it. And yeah, I think this is a new one today. But yep, yep, perfect. Thank you. So dad is 82. He gets Social Security. Mom got Social Security before he passed. Can dad file for survivor benefits on record also? If mom's benefit amount is higher, absolutely. At the very, very least, your father can receive that lovely $255 lump sum death payment. So I would definitely have him reach out to Social Security and get that $255, and they will tell him whether there are any more monthly benefits. But her benefit had to be more than his for him to collect. So, and sorry for your mother's passing there. Kim Jones, single divorcee, never help with estate planning. You mentioned your team handles that. Yeah, I'm trying to. I'm trying to put in estate planning, but right now I'm talking to an organization. It's the American Academy of Estate Planning Lawyers, Attorneys. So yeah, so just go ahead and go to that one, the American Academy of Estate Planning Attorneys, and you can go to that website and you type in your zip code, and it gives you the ones in your area. I'm trying to put up a more definitive, yeah. I think I got an email for you, and yeah, I think I did. And sorry, I haven't responded, but I've got an appointment with that academy in 2 days, and we're trying to come up with something more definitive. So in the meantime, yeah, just go ahead and reach out to them, or again, get on the website, put in your zip code, and it'll give you all the options of people in your area. And I apologize for not getting back to you. I'm a permanent resident working in California for 11 years nonstop. Am I qualified for Social Security pension? Yeah, absolutely. When you're 62 years old, if you have a green card and all that kind of good stuff and you paid into the system, then absolutely. So when you get 62, call Social Security, and if you're not working, or you're staying under your annual earnings limit, then absolutely check out all your options. Granny, what's up, Granny? I'm collecting benefits for my former spouse who is deceased. My now husband and I have been married for 10 plus years. He can collect half of my total benefits, or just on what mine was prior to my survivors. All right. So hopefully you're remarried after 60, so you can collect benefits, survivor benefits, even if you remarry after 60. That's not an issue. Um, so yeah, your current spouse can collect up to 50% of your primary insurance amount minus his own if he's entitled. So it's not what yours is prior to survivor. It's what yours is always, your primary insurance amount, which is basically what you would your full benefit amount at your full retirement age. Donna, I just want to know I am officially addicted to your show. I'm always looking forward to the next session. Yeah, thank you. I appreciate it. Yeah, that's kind of what I'm afraid of. Well, I'm not afraid of you. It's thank you. Is that I'm doing too many of these, but I've been doing it every day for I think 3 weeks now, and I just do the topic, and because I want to again I want to set up a resource of all the different topics out there, and that way when I'm not doing live in the future, you've got a place that you can go to. So I'm doing a live every day, and I'm afraid people are going to say I'm tired of seeing this guy, and they're going to unsubscribe because they're tired of seeing me pop up. But yeah, that's a risk I'll take. So Honeybee, hey Honeybee. All right, let's see here. Patty, divorced after 14 years, remarried now 5 years, taking spouse's Social Security. They never asked me about former marriage. Can I still do that? Yeah. So yeah, you're currently remarried now 5. Yeah. So you can't collect on previous spouses because you're currently remarried. Oh, Emmy, yeah, supported our channel, $9.99. Thank you. Coffee on me. All right, and get my veins ready for the coffee ID. I sure appreciate it. Coffee IV. Yeah, I appreciate it. Thank you. Yeah, if you're currently married, then you wouldn't be able to collect benefits on previous spouses. But if you get divorced, then yeah, you can collect on whichever one's the highest. Carol, your age doesn't enter into it read diverse benefits. If you marry, you become ineligible. Yeah. Okay. All right. So, yep. People are answering other people's questions. I like it. Oh, okay. More people answering other people's questions. I like Kim Jones. No, it wasn't me. Email that is. Okay. Oh, okay. All right. Good. All right. You're not the one I ignored. I didn't ignore. I just put it on hold until I talked to that company a little bit more. But yeah, come on, people, hit the button. Everybody's always looking at. Leslie, if two people have worked their whole lives and are eligible age-wise to receive Social Security, does Social Security only allow them to receive on person Social Security. No, yeah, if they're married or been married 10 years, all that kind of stuff, yeah, you can. Each of them can collect benefits on their own record, and then if one is twice the other, then they can collect a spouse benefit as well to bring the total amount they receive up to that amount. All right, let's see what we got on TikTok here. SSDI, Medicare A and B with Tricare as a supplement. Do I need to file taxes every year? Yeah, I don't do tax type stuff. How early can you retire? If it's just regular retirement, 62. If it's survivor benefits, it's 60. That is when you can start collecting Social Security, retirement, survivor, and all that kind of good stuff. I'm receiving SSDI and paying $600 per month for health benefits from my pension. Do I need both? Well, SSDI is the money benefits, and you're talking about health benefits. So yeah, it really depends. If you're on SSDI, you get Medicare after being on disability, Social Security disability for 24 months. So if you're already paying Part A and Part B, well, A is free, the premium. Part B is $174.70. So that's cheaper than 600. But there's a lot of gaps there. So people get either a Medicare Advantage plan or a Medicare Supplement plan. I recommend the Medicare Supplement plans because you don't have to deal with networks and pre-authorizations and all that kind of stuff. But if your budget just doesn't allow you, get a Medicare Advantage plan. But the extra problem with you is it depends on what state you're in. It's not with you, it's with your government, your state government. Is that a lot of states don't mandate insurance companies to provide Medicare supplements to people under 65. So your state might not even offer a Medicare supplement, a Plan G or a Plan N. And I just did a video on that a few weeks ago. You can check out the differences. So, your state might mandate it, but they don't control the price. So someone at 65 might pay, let's say, $125 a month for a Medicare supplement Plan G. But if you're on disability under 65, you might pay $300, $400, $500, $600, $700 for it, if you're even able to get it. So what a lot of people do is they get the Medicare Part A and Part B, and they get a Medicare Advantage plan, and there's probably tons in your area with zero premium per month. And then when they hit 65, then they get into that awesome window where they can get a Medicare supplement plan, and they can't be denied, and they can't be charged anymore. So those are your options. So you just need to sit at the kitchen table with two pieces of paper and say, okay, I'm paying $600 for this, and here's what I'm getting. If I do Medicare Part A and Part B and a Medicare Advantage plan, again, if you want, give us a call. You're on TikTok, so on the front, on the homepage, it's got my phone number and my email. I can find someone in your area to give you all your Medicare Advantage options, and then you can compare apples with apples, I guess. So, all right, this is going to be the last questions. We're at 113 minutes here, or an hour and 13 minutes. All right, so let's see here. All right, so this would be it. And I apologize, we got some more questions, but I've got to get going. All right, I'm not 65 years old yet, but I just retired and got my Medicare benefits for life. What should I get on Medicare Part A and Part B? Yeah, so looks like I just answered your question. So yeah, if you're on 65, they can't deny you for a Medicare supplement. And so if that's in your budget, so you don't have to deal with the pre-authorizations and the networks and stuff. But if it's not, then a Medicare Advantage is also a good option as well, as long as you keep up on it on a yearly basis and make sure the company you have treats you right. And again, reach out to us, and I can have someone give you a call. Call the number you see on the screen, or email me and tell me your name, your state, because they're all state specific, your phone number, and I will have someone reach out to you and give you all your options. All right. That is it. All right. So tomorrow I'm going to do the Medicare and for veterans and stuff like that. And then because someone had questions on Medicare savings program, we really need to get that information out. So I'll do one on Medicare savings program in a couple of days too. And as usual, I'll do all the question and answers for all the people I didn't get to today for your questions. I apologize. And but please try again tomorrow.